This is a very crucial PLAB2 scenario demonstrating CPR or adult basic life support skills. You are walking to a bus stand and find an elderly gentleman collapsed onto the footpath. There is nobody around to help and no possibility of C-spine injury. Please demonstrate basic life support. So these are clear instructions, and most likely you will be demonstrating them on an adult mannequin. So there are 5 sections to this station, if you remember. One is assess the situation, then immediate actions, then technique of chest compressions, technique of inflation breaths, and then a wrap up. You will be given marks for all of them, and examiner is looking for how you approach all of them. Okay, so the basic life support algorithm is same as what Research Council UK advises. First step, assess the situation. Is it safe to approach? Sometimes in the exam they will put unsafe things around the mannequin. If so, just remove them. In this situation, is it safe on the road, or is the patient on side of a road? Should I consider C-spine injury? The question has already answered that. Now your main action is check response. Tap on the shoulders and at the same time speak loudly to the person. Hello, are you all right? Hello, are you all right? And have a quick look at any clock if available. Now you are assessing a collapsed patient who is unresponsive. Now your immediate actions. First, shout loudly for help. Help, help, help. Open the airway. This includes looking for any obstruction inside the mouth and doing a head tilt and chin lift maneuver. Next, check for breathing for 10 seconds. For this, you will bend over the patient's face, put your cheek against their face. You are looking for chest rise, listening for breathing, and feeling for breathing on your cheek for 10 seconds. By now, you have assessed that patient is not breathing. Phone emergency services. Generally, speak loudly that I am dialing 999. This is the usual response. Sometimes if the scenario is inside the hospital, you can say 2222, but that's a very rare thing. If your scenario gives you a helper, like a nurse or any passerby, they should phone 999. If you are ringing 999, there are few crucial informations. First, explain the situation, give location, please send an ambulance, can you repeat my instructions? These are your immediate actions. Now you will move to CPR. Give 30 chest compressions. Kneel down next to the patient, both arms straight, interlocked fingers. Feel the xiphisternum and go 2-finger breaths above it. Compress the chest to a depth of 5 to 6 centimeters. Fast rate of 100 to 120 per minute. This means you will be giving 30 compressions in only 15 to 20 seconds. After you have given 30 compressions, move on to give 2 inflation breaths. Inhale deeply, fill your own lungs, cover patient's mouth and pinch the nose. Give a sustained 1 second breathing into the patient's mouth. Look for a chest rise. Do it twice. Finally, continue 30 chest compressions and 2 inflation breaths CPR until the ambulance arrives, or if the patient shows any sign of life, or until you are fully exhausted. So CPR session is easy. You have to first assess the situation and check responsiveness. Immediate actions include shouting for help, opening airway, checking breathing and phoning 999, then giving 30 chest compressions, then 2 inflation breaths, repeating the cycle until the examiner asks you to stop. Sometimes such scenario could be that teach BLS to a medical student. Again, tell the medical students, I would be telling you the 3 or 4 sections of BLS. First is assessing situation, and I'll tell you the steps. Then immediate actions, and I will tell you the steps. Then I will tell you how to give 30 chest compressions and the inflation breaths.